There is a medical textbook published in Philadelphia in 1872 that contains a sentence so matter-of-fact in its meaning that it takes a moment to understand what you are actually reading. The sentence appears in a chapter on premature infants and medically fragile newborns. It reads, "In the considered opinion of this faculty, the premature infant represents a weakling whose survival serves neither the infant nor society, and whose death, if it occurs naturally, should not be unduly interfered with by medical intervention." Read that again. A major American medical institution published a sentence in a professional textbook stating that allowing premature infants to die without medical intervention was not only acceptable, but was the medically correct position. That sentence was not a fringe opinion expressed by one eccentric faculty member at one unusual institution. It was the published consensus of one of the leading medical schools in the United States, and it reflected a position that was shared, with varying degrees of explicitness, by virtually every hospital in America at the time it was written. Sick children, premature infants, children born with complications that required medical intervention to survive, these children were not patients in the American hospital system of the late 19th century. They were problems. Problems that the medical establishment had decided, in writing with professional consensus, that the correct response to was to do nothing and let the problem resolve itself through the child's death. I found this while researching the institutional landscape that surrounded the orphan train system. Trying to understand how the removal and redistribution of children on the scale that the orphan trains represented could have been not just legally possible but socially normalized. What I found was a medical system so thoroughly organized around the exclusion of vulnerable children from its services that it changes the way every other institution of the period looks once you understand it. The official story of American pediatric medicine is a story of progress achieved through scientific advancement. Before the second half of the 19th century, children's medical needs were poorly understood across the entire profession. Hospital conditions were dangerous regardless of the age of the patient. Infection was rampant. Outcomes were poor. The development of germ theory, the improvement of surgical techniques, and the emergence of evidence-based diagnostic approaches gradually transformed American hospitals from places associated primarily with death into places capable of genuine medical benefit. Within this broader transformation, specialized children's institutions emerged to address the particular medical needs of young patients. The first hospital in the United States specifically dedicated to children opened in Philadelphia in 1855. Others followed across the subsequent decades. By 1900, there were dozens of children's hospitals operating in American cities. By 1920, pediatrics had been established as a recognized medical specialty with its own training programs, its own professional organizations, and its own academic literature. That story is accurate as a description of what happened within the institutions that were part of it. What it does not describe is who those institutions served, and who they explicitly, deliberately, and in many cases legally excluded from their services. The Philadelphia Children's Hospital that opened in 1855 was established to serve what its founding documents called children of the respectable poor. That phrase carried precise meaning in the social vocabulary of the period. Respectable poor meant white. It meant Protestant, or at minimum not visibly Catholic or Jewish, in a way that would create institutional complications. It meant families whose poverty was understood as the result of circumstances beyond their control rather than as evidence of moral failure. It meant children whose survival and eventual productivity was considered a benefit to the social order rather than a burden upon it. Children who fell outside that definition were not admitted, not turned away at the door through informal discretion, formally excluded through admissions policies written into the institutional founding documents and the operating procedures that governed intake decisions. Children of Catholic immigrant families from Ireland and Southern Europe were routinely refused admission. Children of formerly enslaved families had virtually no access to hospital care in any American city until well into the 20th century. Children born outside of marriage were excluded from most charitable medical institutions on the explicit grounds that providing them with care would constitute endorsement of the circumstances of their birth. These were not the accidental byproducts of institutions doing their imperfect best in a period of limited resources. They were deliberate choices written into the founding documents of institutions that presented themselves publicly as expressions of social compassion and medical progress. The exclusions were the policy, expressed, documented, and defended in the institutional literature of the period. Now, here is where it gets strange. In 1896, a man named Martin County established an exhibit at the Berlin Exposition that would change, though not immediately, the history of premature infant care in America. The exhibit consisted of a glass-enclosed room containing 6 mechanical incubators. Inside each incubator was a premature infant. Visitors to the exposition paid an admission fee to enter the room and observe the infants through the glass. Inside the room, trained nurses moved between the incubators, monitoring vital signs, providing feeding, managing temperature, giving each infant the continuous medical attention that the state of the technology at the time required. Every infant in that first display survived. Martin County brought his incubator exhibit to London, then to expositions in other European cities, then in 1901 to the Pan American Exposition in Buffalo, New York, then to the permanent installation he established at Coney Island in New York City, which he called the Infantorium, located in the Luna Park amusement complex, then to World's Fairs in Omaha, Chicago, and Atlantic City. For more than 40 years, from 1896 to 1943, Martin County operated infant incubator exhibits at fairs and amusement parks across the United States and Europe, charging the visiting public 25 cents admission to observe premature infants receiving medical care. The parents of those infants paid nothing. The admission revenue from curious fairgoers funded the medical treatment of children whose survival the American hospital system had collectively decided was not worth funding. County claimed to have treated more than 6,500 premature infants over the course of his career. The survival rate at his exhibits was substantially higher than the survival rate for premature infants in hospital settings during the same period. Not because his technology was superior to what the hospitals possessed. The incubator technology County used was available to American hospitals throughout his operational period. The hospitals that achieved worse outcomes than a Coney Island sideshow attraction achieved those worse outcomes because they had made a deliberate institutional decision not to deploy available technology on behalf of the patients County was treating. Now, here is the detail that the standard history of neonatal medicine consistently minimizes or omits entirely. Martin County was not a rogue operator working in opposition to the American medical establishment. He was trained in Paris under Pierre Boudin, who was among the founders of modern incubator technology in European medicine. He presented his clinical results at medical conferences. He corresponded with American physicians. He actively invited medical professionals to observe his techniques and examine his outcomes. The American medical establishment's response to what he demonstrated was not adoption. It was classification. County's exhibits were classified as entertainment rather than medicine, as carnival attractions rather than clinical demonstrations, and that classification was used to avoid engaging with the obvious implication of what he was demonstrating. What he was demonstrating was that premature infants could survive with appropriate intervention. What that demonstration implied about the hospitals that refused to provide appropriate intervention was an implication that the American medical establishment chose, for 47 years, not to draw. The sentence in that 1872 textbook was not a description of medical impossibility. It was not an accurate statement that the technology to save premature infants did not exist. The technology existed. Martin County was using it commercially on Coney Island. The sentence was a policy statement, a statement about which lives the medical establishment had decided were worth saving and which lives it had decided were not. Dressed in clinical language to make a social decision appear to be a scientific one. Consider what this means in the context of the other institutional systems operating simultaneously during the same period. The orphan train system was moving children across the country at its peak volume, precisely during the years when Martin County was establishing his first American exhibits. The institutional child removal systems were processing tens of thousands of children annually. The birth registration gaps that made it impossible for families to legally reclaim children who had been taken were at their widest. The medical establishment had formally declared that certain categories of children were not worth the resources required to save them. These were not four separate institutional systems operating independently in the same historical period and happening to produce similar outcomes by coincidence. They were four components of a single integrated framework that together determined which children would survive, which children would be removed from their families and redistributed as labor, which children would be allowed to die without medical interference, and which children would have no legal documentation establishing their connection to the families from whom they had been separated. The children who passed through Martin County's incubator exhibits at Coney Island and the World's Fairs were not publicly identified. Their names were not disclosed in exhibit materials. Their origins were not documented in the promotional literature that CUNY used to attract paying visitors. The public saw infants behind glass receiving care. They did not see documentation of where those infants had come from, who their families were, what institution had referred them to the exhibit, what happened to them after they left the exhibit alive. County described receiving infants from hospitals that could not treat them. He described a continuous supply of premature infants arriving at his installations from medical referral sources, from institutions that had official policies of not treating premature infants. 6,500 infants over 47 years, anonymous in the exhibit materials, documented in County's personal records, records that were never transferred to any medical institution when County died in 1950. Records that were never incorporated into the history of neonatal medicine as that history was subsequently written. Records that are wherever Martin County's personal papers ended up after his death, which is not a location that any medical archive has established with certainty. By 1943, when County closed his final exhibit, American hospitals had begun accepting premature infants as patients. The medical consensus expressed in that 1872 textbook had shifted, not because the evidence had changed. The evidence had been available since CUNY's first exhibit in 1896, not because the technology had improved. The technology CUNY used in 1943 was not dramatically different from what he had used in 1896. The consensus had shifted because the social framework within which the medical establishment was operating had shifted, because the definition of which children deserved the deployment of available resources had expanded to include children it had previously excluded. The shift took 47 years. During those 47 years, the children whose survival the medical establishment had categorized as not worth supporting had exactly two options. They could die in the hospitals that refused to treat them, or they could survive on Coney Island behind glass while strangers paid 25 cents to watch them breathe. The hospitals that excluded those children are still operating. Their founding documents with the admissions exclusions written into them are in their institutional archives. The medical textbooks that declared premature infant survival to be contrary to medical judgment are in university library collections. And the records of the 6,500 children who survived because a man charged admission to watch them receive medical care are wherever Martin County's papers are. Nobody required those records to be preserved. Nobody commissioned a comprehensive study of what the American medical establishment's 47-year refusal to treat premature infants cost in lives. Nobody produced an accounting of how many children died in American hospitals between 1855 and 1943, because the institutions designed to save them had decided, before examining them, that they were not worth saving, that accounting would require the admissions records and the outcome data from the hospitals of the period. Records that were not systematically preserved because they documented decisions that the institutions that made them had no incentive to preserve the evidence of. The incubators at Coney Island are gone. The infantorium at Luna Park is gone. The World's Fair exhibits are gone. The 47 years of demonstrated evidence that the American medical establishment's official position on premature infant survival was a social policy dressed in clinical language are filed under the history of carnival medicine. under the category of curious historical anecdotes about the things people used to do before the profession modernized. Not under the category of evidence that the profession spent nearly half a century allowing children to die in order to avoid acknowledging the implications of what a man on Coney Island was demonstrating 25 cents at a time. The textbook published in Philadelphia in 1872 is still in the library. The sentence about weaklings whose death should not be unduly interfered with is still in the textbook. And the question of how many children that sentence killed across the 47 years between when it was written and when the policy it expressed was finally abandoned is a question that the official history of American pediatric medicine has never been required to answer. If you want more videos like this, make sure to subscribe to the channel. I'll see you in the next one.